You know, some things just make your heart flutter. You know, for Janice, it was Sean Cassidy back in the day. But how do you know when it's time to be concerned about those palpitations and see a doctor about it? Dr. Francis Benn, he's a cardiologist at Grandview Medical Center, joins us this morning to talk about heart palpitations and also Afib. Good to see you this morning.
Thank you. It's a pleasure to be here.
Yeah, native of Ghana, but he's lived all over the country. Now makes Birmingham his home, and we're glad to have you here. All right, but let's talk about that because, you know, there's a difference between just, you know, heart fluttering, but then, you know, there's atrial fibrillation. You can probably say it better than I am, Afib. How do we know which is which?
Yeah, so atrial fibrillation is one of the causes of heart fluttering. In the adult population, it's the most common reason why people have fluttering. You know, but atrial fibrillation is something that you know, once found, there are some things that we need to deal with and manage.
Yeah, because somebody may say, you know, my heart skipped a beat, and which is an old saying, but sometimes that can lead to serious health complications. Talk about if you don't get Afib diagnosed and get it treated, what can happen? Yeah,
sure. You know, there are certain clues that point towards atrial fibrillation. A lot of times, if you notice that your heart is jumping from 120 to 60 or 70 instantly, that sometimes suggests atrial fibrillation. But the most, you know, the way that we can diagnose you with atrial fibrillation is either we get an EKG or with a monitor. And so if you suspect that you are having atrial fibrillation, I encourage you that you see a medical professional who will then get these tests to make sure that you're diagnosed. Because if found, atrial fibrillation increases your chance of developing a stroke. Yeah. And so that's something that it's a serious thing and needs to be addressed.
Absolutely. And so, you know, and for some people, you know, I guess they can feel the palpitations. Maybe others don't. Are there some side symptoms that somebody may notice, whether it's fatigue or something else that may signal something?
Yeah, that's an excellent question. You know, a lot of times, you know, atrial fibrillation behaves different in a lot of people, and in a lot of people it's the fatigue and the tiredness and the sleepiness. That's what they come to see us for, and whether, you know, it's the fatigue or something else, there are different ways and different treatment plans that we can offer to the individual. But aside from taking care of the stroke aspect of it, the other ways that we manage atrial fibrillation are meant to address this fatigue, which is very common in a lot of people.
All right, well, some great information there. Just want to ask you real quickly, in terms of the research on this, what about the advancements of more treatments and maybe more medications that can be used to treat this?
Yeah, you know, I joke around with my patients. I tell them that it's much better to be alive now than it was 20 years ago because the advancement towards treatment of atrial fibrillation has changed a lot. These days, there are things that we can do. In fact, the procedure that's done for atrial fibrillation is called an atrial fibrillation ablation. That procedure used to take almost half a day 10 years ago, but now it's an hour to 2 hours, and it's relatively safe in a lot of patients, and usually it's actually preferred. On the other hand, there are some medicines that we can also try as well, but a lot of times we kind of cater it based on the individual.
Well, obviously you're going to want to see a specialist if you think you're experiencing some of those symptoms, but something to certainly think about. Dr. Benn, we do appreciate it. Thank you for your expertise. All right.
Thank you for having me.